Good afternoon guys, my name is Kris and today I thought I would walk you through what a pap smear is. So if you'd like to learn more, please keep watching. So I think it's really important to start with the fact that in Australia, the guidelines have recently changed and they're no longer called pap smears, though you will hear doctors, nurses and patients all alike saying, I need a pap smear. Don't worry, we know what you mean. What they actually are now are cervical screening tests. So I'm going to give you the spiel that I give all of my patients. Once upon a time, we used to do a pap smear, which is taking a sample of these cells in your cervix, look at them under a microscope and say, yep, they all look normal or they look abnormal and we'll see you in 2 years, depending on your results. We're a lot smarter now and we know that cervical cancer, 95% of the time, is caused by a virus called the human papillomavirus or HPV. HPV is actually a very common virus and there are over 200 strains, most of which cause warts. Very common, especially in kids. We know that there's at least 5 strains of HPV which can be linked to cervical cancer and 2 of which we know definitely cause cervical cancer. This being HPV 16 and 18. So when we have a look at your smear test or your pap smear or your cervical screening, we will run the cells under a microscope like we always have done to see if they look normal or abnormal, but we also test your cells to see whether or not you test positive for HPV. We test about 20 depending on the lab, but most importantly we look for 16 and 18. So that's the science behind a smear test, but what does the actual smear test entail? So to talk about that, we need to know a little bit more about women's anatomy. So if you don't like to hear about that or you want to click away, I will not be offended, but it's really important because it's part of life. 50% of us have a vagina and a cervix. Why should it be embarrassing to talk about? So the vagina is the tunnel, essentially, from the outside to the inside, and the portion of the body where the womb or the uterus begins and then enters is the cervix. I try and describe this and it's a little bit graphic, so my apologies, but if this is your vagina, you've got a cervix at the end here that then balloons out into the uterus. So it's very hard, I'll try and insert pictures. But essentially, when I'm looking at it, it just looks like this very round thing with a dot in the middle of it, kind of like a donut. What I need to do is look at that properly. So we insert what's called a speculum, which is that duck-billed thing that is inserted into the vaginal cavity, opened up a little bit so I can see the cervix at the end. For some women, the cervix is smack bang in the middle and very easy to find, but for some, especially those who have had children, it can be anywhere in the vaginal cavity. I've found them hiding up, hiding down, sort of skewed sideways. It can take a little bit of time, and this is usually the most uncomfortable part of the smear test, is finding the cervix. If I, as the practitioner looking for a cervix, is having a lot of difficulty, one thing I might ask my patients to do is put their hands in fists and put them behind their back or behind their bottom. By tilting the pelvis, quite often you can flick the cervix up a little bit if it is tucked behind or retrovertedly, and this can make things a lot easier. Once I find your cervix, I've got the duckbill. Sometimes I will tighten it so I can move both my hands away, but quite often I'll just hold it with the cervix in the middle. Then I use what's called a cyto brush, or a brush that kind of looks like a trident. It's got 2 shorter sides and then a taller bit in the middle. The taller bit in the middle goes into the cervix, and then the other 2 sides are obviously on the outside. Then as I twist around, I'm getting cells from the outside of the cervix as well as the inside, called the endocervix. Once I've given that a few good twists, I will remove everything, so the brush first and then the speculum, and bingo, your smear test is done. On a good day, these can take as little as 15-20 seconds. On a day where the cervix might be difficult or you've got a history, that means that I have to take a different type of sample or whatnot, it can take about a minute. Once I've collected your sample, I will put it into what I call the witch's pot, which is a little pot full of medium to run it through the PCR and look for the HPV in the lab. Basically, I just swish it around there and then send it away. Now, in Australia, like I said, the guidelines have changed. If you are sexually active, the recommendation is that you start your cervical screening at 25 years old. This is very different to what it used to be, which was 18 years old or 2 years after you started having sex, whichever come later. If your smear test is normal, it is also now 5 years until your next one, which again is different because once upon a time it used to be 2 yearly. This again is because of how far we've advanced in looking for HPV, not just looking at the cells. Reasons that this might be different is if you've had an abnormal smear, if you're pregnant, if you have had surgery on your cervix or your uterus, and a couple of other things as well. So when I get your test results, I get whether or not you had HPV 16 or 18 detected, or no HPV detected, or HPV other detected. If it is 16 or 18, which are the ones that we know cause cervical cancer, the usual next step is to send you to a gynecologist or a doctor who specializes in womanly organs, to then take another sample, usually with a biopsy of the cervix called a colposcopy, but that's not related to this video. This is more about the screening. If it comes up with HPV other, quite often we repeat that in 12 months, as in we repeat your smear test, because most women will get HPV at some point, but eradicate it on their own, just like you eradicate other viruses that cause the common cold, flu, gastro, that sort of thing. This is not gastro for your cervix, I realize what I just said. If you do not have any of the HPVs and your cells look normal, see you in 5 years. It's really quite simple. There are a couple of caveats, as there always is in medicine, which is why my advice is always general. But if you've got symptoms such as pain having sex, known as dyspareunia, discharge after sex, intermittent bleeding when you're not expecting it, or intermenstrual bleeding, changes in your menstrual cycle, if you're pregnant, a lot of different things will actually change the screening, because it's no longer screening, it's an investigation. So screening is when you're feeling normal and we're just making sure there is nothing. Investigation is when there is something wrong and we're looking for why. Common questions I get asked when women come in for their smear tests is it going to hurt? And the answer is no, it will be uncomfortable, but if it hurts, you can say stop and we will stop and we will go ahead as needed. Is it a metal speculum as it used to be? In Australia, where I practice, no, we use plastic one-use only speculums, and we use a bit of medical lubricant to make it less uncomfortable. Mind you, there's actually a reason why we don't use as much lubricant as we possibly could to make it less uncomfortable, and that's because the lubricant itself can affect the cells, which means that your test result may not be as positive, or sorry, as accurate as it could be. Another common question is, can I get my smear test on my period? Controversial. The answer is technically yes, but it is better to be done when you're not currently menstruating, because the blood can give you a different result, which may put you through further investigations that you don't actually need. Another common question is, do I need a smear test if I've never had sex or I've never had vaginal penetrative sex involving a penis? The answer is yes, because you still have a cervix, and there are types of cervical cancer that are caused by things other than HPV. This is called an adenocarcinoma of the cervix, but again, too much detail. But you don't need HPV to get that type of cervical cancer, so we're still screening for it. So it is still important to talk to your GP to discuss whether or not you would benefit from a screening or not. It sounds really simple when I'm talking about it, doesn't it? It's just every couple of years you come in, a speculum is inserted, we smear, take it away, send it off. About a week later we get your results, and we'll see you in either 12 months, 5 years, or we'll send you to a gynecologist. I do so many a day, I guess it is really simple to me, but if you have any questions about smears in general, let me know. Obviously, everything I say is supposed to be general advice, and I cannot tailor my advice to you. I would be a very bad doctor if I tried to give you advice over the internet. So if you have any questions pertaining to your situation, please do go talk to your own GP. I promise this is something we're very used to, whether we're male or female. Alrighty guys, that was my very quick spiel on smear tests. If you have any questions about it, or you'd like any other type of videos like this, let me know. Until then, stay safe, stay healthy, and I'll see you later.